changes, runners can improve their patellofemoral pain. So if you are a runner with patellofemoral pain, some tips such as do not make running your own activity. Go also to the gym twice a week is very important. And another important thing is to avoid running in downhill when the symptoms are bad, because we know that is very stressful for the kneecap. And lastly, when you are increasing your training load, only change one thing at a time.
Mm.
So don't increase your speed running and the running duration at the same time, for example. Each week, only add one thing in to not overload the system. So
But could you introduce yourself to the listener and just tell us a little bit about you and your work and what you're up to?
yeah, sure. Well, I am Amanda Schenatto Ferreira. I am a PhD student from São Paulo State University. Actually, I am almost finishing my PhD, and the main topic of my PhD is the impact of overweight and obesity in patellofemoral pain. So my research is mostly about patellofemoral pain.
Mm.
And I have some collaborations with people from La Trobe. Also, my co-supervisor is working there right now. His name is Danilo de Oliveira Silva,
Oh yeah.
and yeah, and also my supervisor in Brazil is Fabio Micolis de Azevedo. So yeah, we work a lot and we research a lot about patellofemoral pain. And my PhD is specifically about overweight and obesity in patellofemoral pain.
Mm. I'm glad you said your name in the introduction as well, because I'm going to go back and listen to that and then practice pronouncing it before I do your introduction on the show. Because I was reading it, I was like, I'm not going to say it until she says it because I'm going to totally butcher it.
Okay. Nice.
So just for the listeners, I mean, I think most would know what patellofemoral pain is, but could you just describe it for someone who's never heard that term before, what it is?
Yeah, sure. Well, patellofemoral pain is a pain in front, around, or behind the kneecap. So it is a knee condition very, very common in adolescents and young adults that are physically active or do sports. So people who have patellofemoral pain usually don't know exactly how the pain started.
Hmm.
And because it is not linked to any traumatic event like an ACL rupture, for example. So the pain is often linked to movement, like a patient will say, "Oh, it's painful when I go up and down the stairs, or when I walk or run long distance." So this is the typical presentation of a person with patellofemoral pain.
And how does it feel? If I don't know if you've ever had patellofemoral pain. I've had it a little bit over the years. Like it comes and then it goes away, and it's never really been a problem. Like, where do you feel it? And like, is it really sharp? Does it come on like gradually? Does it make you like hobble and not use your leg at all? Like, how does it feel?
Yeah, usually it is the pain is gradually increasing, and there is moments that the pain are there and moments that the pain are not. So, and it's very, very related with movement. So maybe some people suddenly increase their levels of running, for example, and then started to feel pain.
Mm.
So the pain is very diffuse. So maybe in front, around, behind the patella, the kneecap. So yeah, usually it's something like that.
Yeah, and I think that's helpful for the listener because it's not like if you're sitting on the couch or in bed at night, if you have patellofemoral pain, it's not going to be hurting then, almost certainly. It's really, like you said, it's with movement, it's with walking, with running, with stairs, with getting up out of a chair, like that kind of stuff. It's when you're using your knee, right?
Yeah, right. Some people actually feel pain while they are sitting for a long time.
Oh
Uh,
yeah, yeah.
yeah, but usually, very, very usually, is like when they do something, some movement with knee flexion and weight bearing. So yeah.
Yeah, and I don't know if this is true in Brazil, but in in Canada and the UK, we sometimes call patellofemoral pain runner's knee. And I know that becomes a little bit of an umbrella term because some people use runner's knee to refer to lots of different knee pains. But most commonly, I see it used referencing patellofemoral pain. Is that the case in Brazil? Do you have that term as well?
Yeah. We have other umbrella terms. It's very common, like patellofemoral pain syndrome or chondromalacia. Yeah, we have other terms, but at the last consensus about definition, the name, the better name to that is patellofemoral pain. Yeah, but
Okay.
it happens here in Brazil too. Yeah.
Yeah, because it became a syndrome here, and I think syndrome has gone out of fashion now. It's not. It's more pain. I don't know.
Yeah, right. Yeah. So
And then
yeah.
you did some research. The first study I came across that I was just mentioning, but that wasn't specifically on runners. That was, if I'm remembering correctly, that was more on like adolescents, like youngsters who did all kinds of sports. Is that right?
Yeah, it is right. This was, well, I participate in that study back in my master's degree. And yeah, I study about adolescents who do sports and they have patellofemoral pain. And they also have many alterations compared to adolescents who do not have patellofemoral pain. Yeah. But my focus now is in young adults with patellofemoral pain, like 18 to 35 years.
In young what?
Young adults with patellofemoral pain is my focus.
What's a Garrett?
Sorry?
You said young Garretts, I think.
No, young adults.
Young adults. Sorry.
Sorry,
I,
my pronunciation is not so good.
it was fine. It's just I thought you were switching to like a Brazilian word that I wasn't familiar with. Okay, so we young adults with patellofemoral pain now. It's okay. We can edit that out. No, we can leave it in.
Okay, thank you.
And then okay, so and that was the most recent study. I think you were looking at the influence of obesity or being overweight on how patellofemoral pain behaves. Is that correct?
Yeah, it is. Well, as a society, it is a common sense that being overweight or obese is not good for our general health, right? And well, it increases the risk of many physical and mental health conditions. But most of the research in patellofemoral pain so far were in young people physically active, like
Mm-hmm.
runners, cyclists, military, or recreational sports population. So this motivated our research team to explore what happens with people with patellofemoral pain that are not so active, like the ones that are overweight or
Mm.
obese.
Ah, okay. And then, so what did you do in your most recent study that looked at obesity and I don't
Yeah,
know what you call it, being overweight?
yeah. Well, our main questions in that study are how will they compare with young physically active people that also have patellofemoral pain? And will they have a worse or a better clinical condition and outcomes? So to answer these questions, we did a study aiming to first investigate the proportion of people with patellofemoral pain that are overweight or obese based on their body mass index. And then, if being overweight or obese have any impact on physical function and knee and hip strength of people with patellofemoral pain. And for this, we recruited 100 young adults with patellofemoral
Mm.
pain, aged 18 to 35 years, from the general community. And then we conduct assessments of BMI, body composition, such as body fat, muscle mass, and also some functional tests and knee and hip strength.
Mm-hmm. Yeah, I mean that's quite a big study there. 100 people. That's quite impressive because I'm used to reading a lot of studies on runners when 30 is considered a good number. So what how did you decide you needed 100 or did you need 100? What was the thinking behind that?
Yeah, well, we how because we are trying to investigate the proportion of overweight and obesity, we try to recruit as most people as I can with patellofemoral
Okay.
pain. So yeah, this is why we reached that number,
And then,
100.
so all 100 of these people, these youngsters, they had patellofemoral pain. They had this knee pain that you described, this sort of diffuse knee pain that comes on with activity.
Yeah, correct.
Okay.
All they had. Mhm. And well, the main findings we found that from these 100 people with patellofemoral pain included in our study, 62% were normal weight based on their BMI,
Mm-hmm.
24% overweight, and 14% were obese. So this indicates that a large proportion, almost 14% of young adults with PFP are overweight. So
Right.
we,
Okay.
yeah.
So when you take a group of people who have patellofemoral pain, an unusually large amount of them are also overweight. Um, I don't know if you looked into this when you were doing your preparations, but is being overweight like a risk factor for getting patellofemoral pain, or do we not know that yet?
No, well, in our study, we did not investigate that.
Okay.
It was a cross-sectional study. So, but there is some studies about risk factors for patellofemoral pain, the relationship between BMI and the onset of patellofemoral pain in active populations. So, runners, the military is very common, and we did not find an association between being overweight and develop patellofemoral pain in the future in that population. Yeah,
Okay, that's interesting.
yeah,
And so, what did we learn from your study on these 100 people? Because you took some measurements of the different, how much, how to what extent they were having problems with their knee. You looked at their strength and some other things. And what did you learn? Was the differences between those who were overweight with patellofemoral pain and those who were, I don't know what you would call it, regular BMI?
yeah. They interestingly, people who have a higher BMI and higher body fat and lower lean mass also presented reduced strength, reduced knee and hip strength, and poor functional capacity. So, in other words, the higher the body fat and the lower the muscle mass, the worse the function and strength of a person with patellofemoral pain. Yeah,
And how did
so
you measure function? What do you mean by that?
well, we do two functional tests: the plank test, so the uh, yeah, just a simple plank test,
Yeah, yeah,
and
fine.
also the single leg hop test, so
Mm-hmm.
the distance that they could hop and with one leg. Yeah,
And
this,
so from that, we're sort of inferring how capable they are with other tasks like sports and activities of daily living, because these are sort of general functional tasks. And if they're struggling with those, they're going to struggle with other things as well. Is that the thinking behind that?
yeah. Well, we also apply a questionnaire about self-reported function.
Mm-hmm.
So in this questionnaire, we have some general questions about function in different activities. So yeah, maybe we can generalize, but we only assess function in these two functional tests, and with a questionnaire. Yeah.
Okay. And what kind of things does the questionnaire ask the subject?
Well, if people have knee pain when up and down stairs, during running, and if the knee swelling or not, something like that. Yeah.
Okay, okay. So I think we've got a pretty good idea now that how you're determining, that their function or their how much they're affected by the knee pain is worse amongst the youngsters with who are also overweight. And
Yeah.
and you also mentioned lean. I think you said lean muscle mass. Is that something else you measured to look at?
Yeah, yeah. We measure lean mass, and we found that lower lean mass are associated with poor function and reduced knee and hip strength.
Hmm.
So not only body fat, but also lower lean mass were a bad thing for people with patellofemoral pain. Yeah.
And I think this is, I mean, that's what got me interested in it. It's not something I've ever thought about before. You know, when someone comes in to see me in the clinic and they've got patellofemoral pain, I don't sort of really give much thought to being overweight or BMI or any kind of weight management strategies. But I think I mean, from an anecdotal perspective, a lot of people get runner's knee because they take up running because they want to lose weight. You know, that's often you know, when I ask my clients, why do you like running? It's like, well, I'm trying to lose weight. That's a really common answer. So that you've also you've got this sort of double-edged sword, unfortunately, where, you know, the more they run, potentially the more it hurts. But you know so is the takeaway here that we should be applying other weight management strategies to people with runner's knee who present with a higher BMI? Is that what you think the takeaway is from your research?
Yeah, I think it is more like a warning that we need to look at that, and um sure, more research are needed in this field because these findings are very novel. We
Hmm.
don't have much studies about that in patellofemoral pain, but yeah, I think that it sheds some light that we need to look at that, and we need to consider runners with patellofemoral pain, and all people with patellofemoral pain need to consider their body composition and BMI because it may be detrimental to strength, to function. So
Hmm.
yeah, I think that is something that we need to be aware. Yeah.
Yeah, and it's nice to have. It's almost like another lever to pull, you know, because if you have got, I mean, maybe they're not trying to lose weight, but it's like you could draw people's attention to it. It's like, look, people with runner's knee or patellofemoral pain who have a higher BMI, they have worse function, they have more pain, they have less muscle mass, and they tend to have a tougher time. But if we can get the BMI down, potentially those things would improve and may lessen the impact of your patellofemoral pain, right?
Yeah, right. Perfect. We should not only look to BMI, but we need to look to body composition. So we need to reduce our body fat and improve our muscle mass. So these are very important components that we need to look at. Yeah.
I see. So if you had if you were getting more muscular and losing fat, potentially your BMI might not show that. So
Yeah.
what you're saying is we have to look a little deeper at body composition. You know, if we have a very big muscly runner, that's not quite the same problem. So we're really not looking at high BMI. We're looking at high body fat and low lean muscle mass. Is that more accurate?
Yeah. Perfect. Yeah.
Okay.
That is.
Okay. And then is that where you're going with this? Is that because you said you're hoping to finish your PhD soon? Is that what you're doing, or you branched off in another direction now?
Yeah, we also investigate more things about how overweight and obesity impacts biomechanics, psychological factors, and also pain sensitization. So we have much more thing to understand and to look at, and we are still in process. But yeah,
That's a
I
lot.
feel
That's a lot. So,
it's a
I don't
lot.
know if you're going to finish your PhD soon. If you're going to do all of that.
Yeah, true.
Are you
Oh.
doing any studies at the minute, or has sort of COVID put a bit of a damper on research efforts currently?
Yeah, well, I right now I'm still working on my PhD data, so this is my focus now. Yeah, but
Okay, so you don't need to collect anymore. You've got the data collected.
yeah, I finished. Yeah.
And I think you, like, I looked back at some of your other work, and you looks like you've had a interest in patellofemoral pain for a while. And I think you'd done some work looking at women with patellofemoral pain and you know, their muscular strength and that kind of stuff. What did you find there?
Yeah, well, back in 2016, I started my a master science by research in PFP, And at that moment, we knew that knee and hip maximal muscle strength were impaired in women with patellofemoral pain when compared to pain-free women. However, most of our daily activities are performed at a fraction of maximal muscle strength. So
Hmm.
we don't use our maximal strength to walk, to climb a set of stairs, or to run. So we decided to explore other components of muscle function beyond maximal muscle strength, thinking that these components could be more related to daily activities. So the main aim of my master's was to explore different components of knee and hip strength in people with patellofemoral pain, such as power, that is defined as the ability to increase force from a low or resting level as quickly as possible, and also the ability to maintain a steady contraction. So, for example, muscle power is very important for runners that have a very short contact time on the ground and need to generate force rapidly to keep moving forward, right? So what did I find? We found that women with patellofemoral pain have deficits not only in maximal knee and hip strength, but also in power and in the ability to maintain a steady contraction compared to pain-free women. So they presented deficits in all these components of muscle
Mm.
function.
Yeah,
Yeah,
that
not
makes. I never really thought about that because people, like, if we take women with patellofemoral pain, they don't say, it hurts when I do loads of hops or when I do my, 1 rep max squat. They say, it hurts when I walk up the stairs. It hurts when I run for 5 minutes. Like, it's like you say, it's not these maximal effort things that are evoking the pain. So it makes
yeah.
sense that there would be deficits not only in maximal muscle strength but in some other factors. So is that what we found, that you take these women who already have patellofemoral pain and they have trouble with like power, so that's like generating force quickly, as well as the amount of force they can ultimately generate, as well as the ability to hold a contraction statically
Yeah,
without moving. So they're deficits across the board.
yeah, true. That's it. We found that women with patellofemoral pain have higher deficits in those components, and not only maximal muscle strength. And and if we think about that, this means that runners with PFP also need to include some gym sessions in
Mm,
their training schedule. So strengthening is a really powerful and important supplemental training to runners. And at least twice a week, seek some guidance to complete strength and power training. Pick up a half dozen of weightlifting exercise and no more than that. Exercise that focus on your calf muscle, thigh muscle, also exercise to your hip extensor muscles. So make it simple, work on with heavy weights that you can lift more than that you cannot lift more than 6 to 8 times, and keep your training simple but heavy. So
mm.
we need to do some gym sessions with the running training. Yeah.
So, what would be an example of, because you're a physio as well, right? So, if you had, let's say, a woman with patellofemoral pain and you wanted to get, you know that she's likely got these deficits, maybe you can measure them, or maybe that's just sort of predicted from the research. What would be an example of a strength program she might do? I know it would depend, like how bad her pain was and stuff, but I just want to give the listeners some idea of what kind of exercises we're talking about and how often and how heavy, kind of thing.
Yeah, well, as I said, we have to focus on exercise targeting calf muscles, thigh muscles, so something like squats and lunges and something like that
Mm,
that focus on our calf muscles, thigh muscles, hip muscles, like our gluteal muscles. So maybe two times a week is important. And yeah, I think also the key is to keep simple, no more than six or eight exercise.
mm.
Only six exercise are very good, are okay. Yeah.
Yeah, and I think that's a nice take home for the listeners, right? Because we don't need to get crazy complicated. You know, the exercises you just mentioned, so calf exercises, right? There's like a heel raise, a calf raise, and then squats, lunges. Everybody knows what they are. And then,
Yeah.
maybe some other things that target your glutes and your quadriceps, typical gym exercises, and just keep it simple, and then make it heavy, right? So you can only do 6 to 8 repetitions. And if you do your lunges and you can do like 20 of them, well, you need some more weight, right?
Yeah, right, right. Perfect. Yeah. And
and
I think it is important seeking guidance, preparing their body before start running and during running. It is essential. So it is also important to say that this preparation needs to be monitored by a physiotherapist, as it must be individualized for the needs of each patient. So for each deficit, we need a different and a specific training. So this is a general recommendation, but we need to individualize our training.
yeah, and I think that's the thing. Once your knee is painful, then you need some help with this, because if you do a lunge, it might hurt straight away, and then it's like, well, what do I do with that? And that's where physios or other such professionals can be really helpful. But I guess I didn't ask, and I don't know if this is the case, because you took runners in this study and you were looking at women who already had patellofemoral pain. Do we know if the weakness that you measured, let's just call it weakness to keep it simple, is
Mhm.
that like a cause or an effect? Do we know, did they get the knee pain because of this weakness, or is this weakness coming on because their knee hurts now and they're not using their leg as much, or some other such thing?
Well, what we know about that is that weakness in quadricep muscles is a risk factor for
Mm.
PFP development, mainly in military and athletic population. And it seems that weakness at the hip are not, so is more like a consequence. But yeah, this is all we know about that. It
Okay.
seems that weakness at the quadriceps is a risk factor to PFP development. Yeah.
So if we sort of put those together, we've got some studies that indicate that weakness in your quadriceps might make you more likely to get patellofemoral pain. And then we've got your work that shows that women who have patellofemoral pain have weakness, um, they have loss of muscle power. And
Yeah.
then as well in your adolescent population, we've got lower lean muscle mass and lower strength in the people have higher who are more, in the more obesity in the obese sort of group, and they have worse symptoms. So it's all sort of indicating that muscle strength around the glutes, the quads, the thigh, the calf is a big factor when it comes to patellofemoral pain, and something that we should definitely be working on if you have that problem. Is that a fair sort of summary?
Yeah, perfect. It is true. We mainly look at young adults, age 18 to 35 years. So all this is true for them. We don't know so much about adolescents or older populations.
Hmm.
So, and also the exercise are the cornerstone to PFP management. So exercise targeting hip and knee are the main recommendation at the consensus about patellofemoral pain. So yeah, it is the main focus.
Yeah, there was I think it was Rich Willie and some of his colleagues put out some guidelines for the American physios in a sort of clinical practice guideline a couple of years ago, and that was it. That was the main thing. It was like the best evidence says strength training
Yeah.
of various different kinds has been shown across the research to be the best way to help people with this problem. So then it kind of tracks all the way through, right? You can see it can predict this weakness, it can make it worse when you've got it, and working on it can make things better. So it's all starting to, we're getting some sort of evidence story that makes sense, which we can work with, right? I guess because something that's
Yeah.
I come across sometimes is, you got a runner, or let's say a female runner comes in, she's got pain on the back of her kneecap. She's got patellofemoral pain. And, you know, then we're like, okay, you're going to do some lunges, you're going to do some squats. And she's like, what? The back of my knee hurts. Like, what? Why would I do that? So how do you get around that problem in the clinic? How do you explain that to people to help them get on board with this plan you've got for them?
Yeah, usually when the symptoms are really bad, the recommendation is to start with some hip exercises, and then as soon as the symptoms come down, we started with knee
Yeah.
exercise. Yeah, so this is a very strong recommendation,
Mm.
and uh, and yeah, I think that's it. So people need to understand that the pain will will reduce with exercise. So we need to strain, we need to focus on that, but we will avoid any exercise that cause pain. So if people report more than 3, 4 in a scale of 0 to 10,
Mm-hmm.
we need to stop that exercise and do other, yeah, something like
Cool.
that.
I'm glad to hear you say that, because that's exactly what I do with people. So what I often say is, you know, the trick here is we've got to get you strong without annoying your knee. So we've got to work around it. We're going to make your muscles stronger, but we can't, the knee's angry, so we can't make it more angry. So we've got to work around it. And then it's just similar to what you just said. We're going to work away from it initially and then move towards it as it calms down. And
Yeah.
I think that can be a good way, because if you give people exercises that hurt, I mean, it's just common sense. They're not going to do them after a while. I mean, as long as they do it if it hurts a little bit, you know, like you said, 1, 2, 3 out of 10, maybe a 4. But once it gets higher, it's common sense. You just kind of stop doing it because it's like, well, this is hurting. And then I think, I don't know if they were so much, I don't know how heavily involved you were, but I saw you had some studies or reviews looking at knee crepitus. Is that right?
Yeah, it is. Well, this is such an interesting topic. Many people with PFP are really worried about crepitus.
Can we, just before we get into it, can we explain for the listener what we're talking about? So what is crepitus?
Yeah, sure, sure. Well, first, this great body of research was led by Dr. Danilo de Oliveira Silva that I mentioned before. But knee crepitus, in simple terms, is a crackling or popping sound that some knees make when they move. So they are more common in loading tests like running or squatting, but we don't know exactly what causes a noise knee. Some research say it is due to a buildup or bursting of tiny bubbles in the synovial fluid or snapping of ligaments, something like that. So it is hard to say what causes knee crepitus. So we focus more on its implications for people with patellofemoral pain in our studies. Yeah.
And what did you find? Is it important? Is it something to be concerned about?
Yeah, well, we found that women with patellofemoral pain are more likely to have knee crepitus than pain-free women. However, 33% of pain-free women had knee crepitus. So this is not an exclusive finding of people with knee pain. But more importantly, is that people with patellofemoral pain who have knee crepitus have similar levels of pain, function, fear of movement, and knee strength compared to those with patellofemoral pain without knee crepitus. So, in other words, if a patient has patellofemoral pain and a knee crepitus, it doesn't mean their condition is worse than those who have patellofemoral pain and no knee crepitus. So I think that the take-home message about these studies is just don't worry about your noisy knees, or they are just noisy knees. Yeah.
But that's really nice to hear, because I get that question every single time someone has knee crepitus, the crackling, the grinding, they sometimes call it. And whether these are people, you know, who, you know, they just mention it because maybe we do some tests and they're not in to see me about patellofemoral pain. It's about something else. They'll be like, oh, my knees always grind. What is that? Like, should I worry about that? And
Um,
it is like a worrying thing for people. But
yeah,
I think what you're saying is, yeah,
yeah,
it's you get if you have patellofemoral pain, your knee can grind or not, and it doesn't really seem to make much difference to your overall outcome.
yeah. It is exactly like that. It doesn't mean that you will have worse function or worse clinical condition. It is just a noise knee. Yeah, it is.
And I don't know if we have the research on this at the minute, but do we know if having that knee crepitus, is that a bad sign for the future? People who have that more likely to have problems, or is that something we don't quite know yet?
Yeah, we don't know yet for sure, but well, if it is not a problem right now, we don't think that may be a problem in the future, but we really don't know
Mm.
about it because we don't have this data yet. Yeah.
And I think the important thing to remember for anyone who does have crackly knees when they go down the stairs or whatever is that, you said in your studies that you had people with knee pain and you had, you had people with knee pain with crackly knees and people with knee pain without crackly knees. So it's like, it's not sort of a death sentence. You can get to the point where your knee can crackle and not hurt, because the crackling
Yeah.
can be annoying. But
Yeah.
really, what
Yeah.
we're worried about is the implication of it. Doesn't mean that we're having some trouble in there that's going to, stop us running or whatever in the future. I think that's what people are really worried about. And I guess your take home would be probably not. You probably don't need to worry about it too much.
Yeah. Perfect. It is right there.
Okay, cool. Well, I think that's a sort of nice positive note to end on. Is there anything else you wanted to share with us that you've learned about patellofemoral pain that our listeners might be interested in just before we sign off?
Well, I think that although my research is not specifically focused in a running population, we can take some important lessons for runners. So, considering that overweight and obesity are modifiable factors and may be detrimental to strength, to function, so runners who have patellofemoral pain should consider these findings. And although we still need more research in this area, it is possible that by reducing body fat and increasing muscle mass and strength, PFP symptoms may be improved,
Mm,
regardless of the physical activity you do. So, and also, although patellofemoral pain is very common in runners, the good news is that through some changes, runners can improve their patellofemoral pain. So if you are a runner with patellofemoral pain, some tips such as do not make running your own activity. Go also to the gym twice a week is very important. And another important thing is to avoid running downhill when the symptoms are bad, because we know that is very stressful for the kneecap. And lastly, when you are increasing your training load, only change one thing at a time.
mm.
So don't increase your speed running and the running duration at the same time, for example. Each week, only add one thing in to not overload the system. So yeah, I think that these are my big take homes for the listeners and for runners.
Yeah, and I think that's a very nice, evidence-based sort of summary of, okay, this is what we know. These are the steps you can take to try and avoid patellofemoral pain and to rehabilitate it if and when you develop it. Is there anything, if people wanted to follow your work, is there anywhere you would like to point them to? Anything in particular?
Yeah, well, first, I hope that people find it helpful. And if you have any questions or want to know more about my research, I am on Twitter. So my Twitter handle is Amanda underscore Schenatto. I think you can put there in somewhere.
I'll put it in the description, yeah, and I'll put a link there so that people don't have to remember it. Yeah.
Thank you. And so, well, feel free to contact me there. I will always be available. So, yeah, thank you so much for having me.
Well, thank you very much for making the time for us. It was very informative. Keep up the good work. We'll keep an eye on your ResearchGate profile, and if and when that PhD is finished, we might get you back on to talk about it. And
Yeah.
yeah, best of luck with it.
Thank you. Thank you so much.
All right, thanks, Amanda.
Thanks. Bye.
Bye.